1 in 8. That's how many women develop breast cancer during her lifetime. Think about it, in a room of 24 women, 3 might be secretly fighting or fearing this disease. This could be about you, your mother, your sister, or even your friend. This is about understanding breast cancer in a way that could save a life. Some might think breast cancer is genetic, but in fact 85% of breast cancer cases happen to people with no family history. You know what? Breast cancer isn't just about women, men can get it too. Imagine your body is like a peaceful city where all the cells are happy and working together to keep things run very smoothly. But one day, one of these normal cells gets infected. Just like a zombie virus, something goes wrong with its DNA. This infected cell starts behaving strangely. This could be due to exposure to harmful radiation like UV rays, smoking, or consuming alcohol, or unhealthy habits, or even due to genetic condition. This zombie cell starts to multiply, creating more zombie cells in the city. They just don't follow the normal rules, creating chaos. Normal cells know when to stop growing and where to stay, but these zombie cells don't. They keep growing and invading other areas, causing damages all over our body. These zombies consume energy and oxygen that normal cells need to survive. They take over the food supply, leaving the normal cells starving. As the zombie population grows, they even break through the city's borders and invade neighboring areas. In breast cancer, zombie cells can spread from the breast to the lymph nodes, liver, lungs, bones, and different parts of our body, and this is called metastatic cancer. Here comes the savior, our body's immune system. It's like a team of police trying to fight off these zombie cells. But sometimes the zombies are just too many, making it harder for the immune system to fight them. And that's why doctors and scientists are working on new ways to find and fight these zombie cells to keep the city, that is, your body, safe and healthy. But here's the good news. If we spot the zombie outbreak early, we can stop it. And one of the best ways, self-examination, that you can do it in your home. Let's break down breast examination into two crucial parts, visual inspection and manual inspection. Remember, your breast might feel different at different types of the month, and that's totally normal. The best time for this security check is a week after your period starts. That's when your breast least likely to be tender or swollen. Coming to visual inspection, in visual inspection, stand in front of a mirror with your arms raised above your head. This allows to observe your breast for any changes in size, shape, symmetry, nipple position and skin texture. Then look for dimpling or indentation of the skin or redness, swelling or changes in color. Check for inverted nipples or any discharge from the nipples or any lumps that can be seen or felt. And then manual inspection. It involves touching and feeling of your breast to check any lumps, thickening or any other changes. You need to lay down for this step, which makes it easier to examine the entire breast. For this, use pads of your fingers, not the tips, to feel the breast, applying varying levels of pressure to detect any abnormalities. Check under the armpit, that is axillary lymph nodes, then entire breast from collarbone to the lower ribs and from the center of the chest to the armpit. Then check the nipple and areola for any changes or discharge. These steps are extremely crucial when you do a self-examination. After self-examination steps, professional screenings are mandatory, like mammogram, which provides detailed image of breast. I recommend ladies above age 40 to go through the screening process. Then clinical breast examination, which is done to check any lumps or any other abnormalities in breast and underarm areas. And MRI, which is recommended for women at high risk. But screening alone isn't enough. Knowing your risk factor can empower you to take proactive steps in your breast health journey. Genetic factors, that is family history of having first degree relative, mother or sister with breast cancer, can significantly increase the risk. Second, hormonal factors like age and menstrual history. The risk of cancer can increase by age, early onset of menstruation before the age 12 and late onset of menopause after age 55. Next is lifestyle factors, which include being obese or inactive in physical activities or frequent intake of alcohol consumption. Environmental factors include exposure to radiation or linked to increased risk of breast cancer. Okay, if cancer is detected, don't panic. There are effective treatments available and early detection makes a huge difference. Sometimes just removing the tumor is enough, that is lumpectomy, while in other cases removing the whole breast, that is mastectomy, might be necessary. Then radiation and chemotherapy to destroy the cancer cells either after the surgery or main treatment. Then immunotherapy, a newer approach that helps body's own immune system to fight against cancer cells. Although cancer might not be always preventable, but leading a healthy and balanced lifestyle, reduced alcohol consumption, quit smoking and lesser exposure to UV radiation might reduce the risk of breast cancer. As I mentioned earlier, women above age 40 are recommended to take mammogram and other screening process as early as possible, because the next one in age should not have to be you or someone you love. Don't let this be just another video you watch. Share this with your family and friends and comment health if you want us to post more health related content.